Welcome. The name of our QR project is Improving Diabetic Ketoacidosis Management in Patients Admitted to the Inpatient Telemetry Unit. Introduction. Challenges in following the University Health Truman Medical Center Diabetic Ketoacidosis protocol likely influence the time a patient remains in an acidotic and dehydrated state and may increase the risk of complications. The following is a flow diagram showing the DKA management and flow as patients are transitioned from the ED to the inpatient unit. And the diagram also outlines key pain points that were identified. The aim of the study, the primary outcomes are to decrease by 10% the average time to administer the initial bolus IV fluid, decrease by 10% the time to initiate the insulin drip, and decrease by 10% the time to administer the long-acting insulin. And we will do this by providing nurse and resident education about the DKA management and implementing a time-sensitive push notification to nursing staff between the dates of December 2021 and April 2022. Methodology. We introduced a push notification called Smart Zone through the Cerner EMR that informs nurses to act on critical DKA-related changes, such as closing of the anion cap and the sugar being less than 250. The second intervention was nurse and resident education on DKA protocol management. Lastly, the data was analyzed using run charts on 20 pre-intervention mild to moderate DKA patients admitted to the telemetry unit and compared to 6 post-intervention patients on the same unit. Results. The first diagram is the DKA protocol flow chart that was used for nurse and resident education. The chart was based on our current DKA protocol. As you can see, the chart includes how to manage IV fluids, including the D5-LR and D5-NS titratable drip, how to manage the insulin drip, and how to manage potassium and phosphorus repletion. The following diagram is an example of one of the nursing questionnaire questions, and this one was displayed due to its relevance to the current ideation of the study, and it showed that 84% of nurses moderately to strongly agreed that nursing prompts for DKA management would be helpful, compared to 15% that responded that they experienced alarm fatigue. Next are 1 to 5 run charts that display our post-intervention and pre-intervention data analysis. As you can see, the first run chart is labeled time differences between initial diagnosis of DKA and the first IV fluid bolus. Each run chart includes the times of each intervention, being the resident education, nursing education, and Smart Zone intervention, and includes our optimal goal times for each protocol measure, and also includes the percentage difference between the pre-intervention and post-intervention. In conclusion, no statistical improvement was noted post-intervention. However, there was a trend towards less variance and shorter time to action for each measured DKA protocol item. Limitations include the small number of DKA patients treated on the telemetry unit, nursing turnover, long ED board times, and differences between the ED and inpatient DKA protocols. Longer study times to include more post-intervention patients may have allowed for statistically significant results. Moving forward, congruence between the inpatient and emergency department DKA protocols and improvement in the protocol itself were identified as future opportunities for improvement. Thank you very much.